Good day, everyone. I'm Lady Angela G. Carbenio, and I'll be doing my learning reflection based on Patient Bill of Rights. So, as a student nurse, I must be aware of the significance of patient rights and how it may affect my practice. This will help to avoid potential difficult clinical, professional, and legal situations. So, patient care is at the heart of nursing practice, and the effectiveness of the care process is determined by the relationship between patients and nurses. So, as a student nurse, I have the knowledge and abilities to properly treat a patient to help them cope with their conditions by providing information or allocating resources. So, although nurses have these abilities and knowledge, it is critical that they are used responsibly without jeopardizing the patient's rights. So, patients enjoy a number of rights derived from international agreements such as the Human Rights Act and including healthcare related rights. Establishing a formal ethics education for us future healthcare practitioners may benefit from determining medical students' awareness of patients' rights. This knowledge can aid in building curricula and educational interventions that focus improving students' awareness of patients' rights. So, patients may be more compliant if they believe their rights are effectively safeguarded, which will lead to better treatment outcomes. So, one of the fundamental goals of healthcare practitioners is to provide a high quality care to all patients while recognizing their particular needs and rights. To achieve this goal, the patient and the healthcare professional must collaborate to achieve and maintain optimal health. So, one of the most essential ethical problems that the healthcare worker should be aware of is patients' rights. So, the Patient's Bill of Rights is a set of rights that is um, set for the rights that patients in the healthcare system that healthcare practitioners must adhere to. So, however, some of the studies that I've read show that there is a significant understanding gap between healthcare providers, patients, and general public when it comes to patients' rights. So, to give high quality care to patients, we as healthcare provider must become aware of and comprehend their patients' rights. So the Patient Bill of Rights compliance not only protects patients from harm, but also protects healthcare providers like me from legal consequences if mistakes are made. So the Patient Bill of Rights assures that each person receiving medical treatment has their rights and dignity protected and valued. To give quality service to people, healthcare personnel must be aware of these rights. So, as a learner of this module, it gives me strength to learn more in demonstrating good quality in dealing with my patients, group mates, and colleagues. As for the weaknesses, I face so much challenges in life in conquering my fear for making mistakes in front of my patients through the circumstances that I encounter in my everyday responsibility. I have developed new skills and talents. With critical thinking, it is one of the most crucial skills in medical professionals to learn, to develop, and retain. So, whether we are students or practicing nurses, as a nursing student, I may improve myself in delivering better care to my patient by leading with logical and assessing data in real time. So, patients have the number of rights that should be respected and taken into account while making medical decisions. So, right can only be contested or reversed in extraordinary circumstances, and legal challenges are frequently required to do so. As a nursing student, I should be able to recognize key patient rights, upholding those rights